10 Early Indicators of Dementia. When to seek professional attention. As we age, our bodies and minds undergo various changes. While some alterations are natural and unavoidable, certain early warning signs can indicate serious medical conditions that, if not identified promptly, may significantly impact quality of life. Among these, dementia is one of the most prevalent and dangerous. Did you know that the initial signs of dementia can be subtle and easily overlooked? We often disregard minor changes in daily routines, yet these seemingly insignificant details may hold the key to early dementia detection. Let's explore 10 early warning signs of dementia that you should never ignore. 1. Adjust your posture. Changes in posture and gait are significant early indicators of dementia that many may not immediately recognize. These alterations reflect not only physical changes but also signify cognitive decline, particularly as the brain weakens and loses its ability to control muscles and balance mechanisms. The video highlights several key postural changes. Shorter steps. One of the first noticeable signs is a reduction in stride length and fluidity. Instead of long, even steps, individuals with dementia often take shorter, shuffling steps. This reflects a decline in the brain's ability to control movement. Shuffling gait. This easily observable sign involves dragging the feet rather than lifting them adequately. The inability to lift the feet properly suggests impaired neurological function, controlling the leg muscles. Difficulty with utensils. Everyday tasks like holding a cup, spoon, or fork become challenging as muscle control and hand-eye coordination deteriorate. The struggle with these simple actions stems from cognitive decline and impaired motor control. Loss of balance. Individuals with dementia are prone to imbalance, leading to unsteadiness and increased risk of falls, even in familiar environments. Maintaining an upright posture becomes difficult, often requiring assistance for ambulation. Stooped or leaning posture. Some individuals develop a stooped posture or lean to one side due to loss of bodily control and impaired postural maintenance. This may manifest as a noticeable lean or inability to stand erect. This postural change is a subtle yet important indicator of the underlying neurological deterioration. The progressive nature of these changes underscores the importance of early detection and intervention. Observing these subtle shifts in gait and posture can be crucial in identifying dementia early, allowing for timely diagnosis and management, potentially improving quality of life and slowing disease progression. Regular observation by family and caregivers, coupled with professional medical assessment, is vital in managing this complex condition. The fundamental cause of these postural changes lies in the brain's crucial role as the central control unit for the body's motor functions, encompassing coordination and balance. As neuronal cells within the brain gradually become damaged, the brain's ability to control muscles and coordinate movement diminishes. This impairment not only affects mobility, but also leads to muscle weakness and reduced strength, making it increasingly difficult to maintain balance and perform movements with the same ease and proficiency as before. The resulting instability contributes significantly to the increased risk of falls and related injuries. Early recognition of these subtle postural shifts is paramount for effective preventative measures and timely intervention. A proactive approach, incorporating gentle physical activities, such as walking or yoga, can significantly improve balance and help maintain motor function, thereby slowing the progression of the underlying neurological condition. Regular, moderate exercise strengthens supporting muscles, enhancing stability and reducing the risk of falls and associated injuries. Furthermore, early diagnosis allows for the implementation of appropriate therapeutic strategies, potentially mitigating the severity of symptoms and improving the overall quality of life. In conclusion, alterations in posture serve as a critical, early warning sign of neurological decline that should not be overlooked. These changes reflect a progressive deterioration in the body's motor control capabilities and represent a significant indicator for early disease detection. Prompt identification allows for the implementation of interventions aimed at slowing disease progression and improving the patient's functional independence and overall well-being. 2. Sensory considerations. Sensory issues are among the earliest warning signs of dementia. As brain function declines, the ability to process and react to sensory stimuli from the environment is also affected. These sensory changes encompass not only the loss of sensation, such as pain, temperature, or touch, but also alterations in how individuals perceive and respond to their surroundings. The video highlights several key sensory problems associated with dementia. Reduced sensitivity to pain and temperature. One of the first noticeable signs can be a decreased ability to perceive painful or extreme temperature stimuli. Because the brain is no longer effectively processing signals from the body, individuals with dementia may not register pain, even from injuries or burns. This significantly increases the risk of unnoticed injuries and subsequent complications due to a lack of awareness of pain or danger. Difficulty recognizing objects and people. Another common sensory issue is difficulty recognizing familiar objects or people. Dementia can impair the ability to identify familiar items or shapes, leading to challenges in interacting with the environment. For example, a person might not recognize their own phone or remember how to use it. This difficulty extends beyond inanimate objects to include facial recognition and the identification of loved ones. Visual and auditory disturbances. Visual and auditory impairments can also manifest in the early stages of dementia. Individuals may struggle to see objects clearly or perceive sounds accurately. Vision may become blurry, or they might experience visual hallucinations, seeing things that aren't there. Similarly, hearing loss can lead to difficulty understanding speech or experiencing auditory hallucinations. Altered spatial awareness. People with dementia may experience spatial disorientation, feeling lost even in familiar environments. This can lead to feelings of unfamiliarity in their own homes or an inability to judge distances accurately. This not only impairs mobility, but also contributes to anxiety and distress. Impaired risk assessment and environmental awareness. Sensory problems often manifest as an inability to accurately assess the danger of a situation. For instance, they might not feel fear when near hazards like fire, or show no apprehension when walking on slippery surfaces. This demonstrates a clear deficit in environmental awareness and risk perception, potentially leading to dangerous situations. This lack of awareness can extend to personal safety, hygiene, and self-care, requiring increased supervision and support. Understanding these sensory changes is crucial for caregivers and healthcare professionals in providing appropriate support and mitigating potential risks for individuals living with dementia. The fundamental cause of sensory issues stems from the decline in brain function, particularly within areas responsible for sensory perception and processing. When the brain is damaged, neurons are unable to transmit sensory information accurately and efficiently. This not only impacts the perception of external stimuli, but also alters the body's response to factors such as temperature, light, and sound. The resulting sensory disturbances can manifest in various ways, ranging from subtle changes in sensitivity to complete loss of sensation. For example, a patient might experience diminished tactile sensitivity, leading to difficulty with tasks requiring fine motor skills, or they might exhibit reduced pain perception, increasing their risk of injury. Similarly, alterations in temperature sensation can lead to burns or hypothermia. Early identification of sensory problems is crucial for mitigating risks and enhancing the patient's quality of life. Recognizing a patient's diminished or absent pain sensation, for instance, allows caregivers to implement protective measures such as creating a safer environment, carefully controlling temperature, and adapting their approach to patient care. This proactive approach extends to other sensory deficits as well. Early awareness of these changes enables the timely implementation of appropriate therapeutic interventions and support systems, ultimately contributing to a better quality of life and prolonged independence for the individual. In conclusion, sensory disturbances represent a significant and often early indicator of cognitive decline. Changes or loss of sensation not only impact daily living, but also serve as a clear marker of deteriorating brain function. Prompt recognition and intervention are therefore essential to preserving the patient's quality of life and minimizing the risks associated with sensory impairment. A multidisciplinary approach involving neurologists, therapists, and caregivers is often necessary to provide comprehensive assessment, tailored interventions, and ongoing support for individuals experiencing these challenges. This collaborative effort aims to maximize the patient's functional abilities and overall well-being. 3. Areas for improvement. Loss of muscle control is a hallmark symptom of muscle weakness, often manifesting as a noticeable decline in the ability to control one's muscles. Individuals experiencing this may struggle with seemingly simple actions such as walking, rising from a seated position, or even grasping objects. This difficulty stems from damage to brain regions responsible for muscle coordination and control. Affected individuals may experience pronounced weakness and fatigue during routine tasks, or exhibit a loss of balance while ambulating. As the condition progresses, a significant decline in overall strength becomes evident. This isn't merely a feeling of weakness, it translates into a tangible difficulty in maintaining physical activities such as walking, climbing stairs, or performing household chores. The onset of easily induced and rapidly escalating fatigue can lead to increased dependence on others for assistance with daily tasks. This muscle weakness significantly increases mobility challenges and elevates the risk of falls, potentially resulting in serious injuries. Beyond generalized weakness, some individuals experiencing cognitive decline may also encounter difficulties with coordinated muscle movements. They might struggle with precise hand and foot movements, or find themselves unable to complete simple tasks like opening a container or using tools. This stems from deterioration in the brain regions governing motor control and the ability to coordinate muscle groups. The resulting impairment can significantly impact daily life, affecting independence and requiring adaptive strategies for managing activities of daily living. Muscle weakness can significantly impair a patient's ability to perform activities of daily living, ADLs. Simple tasks such as dressing, bathing, preparing meals, and navigating the home can become exceedingly challenging for individuals experiencing muscle weakness, particularly those with cognitive impairment. This dependence on caregivers or healthcare professionals for basic ADLs can negatively impact their quality of life and sense of independence, leading to feelings of frustration and isolation. The risk of falls is substantially increased in individuals with muscle weakness. The compromised ability to maintain balance and stability during movement increases the likelihood of falls, especially in unsafe environments, such as slippery floors or areas with obstacles. Falls can result in serious injuries, such as fractures, further limiting mobility and hindering the recovery process. The consequences can be far-reaching, impacting not only physical well-being but also mental health and overall quality of life. Importantly, muscle weakness may serve as an indicator of cognitive decline and impaired brain function. The brain and muscles are intricately connected through neural pathways. Therefore, cognitive impairment can disrupt the signals transmitted from the brain to the muscles. This disruption manifests as reduced ability to perform even simple movements, leading to fatigue, discomfort, and a general decline in functional capacity. Early identification of this connection is crucial for comprehensive patient care. The etiology of muscle weakness is multifaceted. It can stem from various factors, including neurodegenerative diseases causing a decline in the ability of the brain to control muscles, deficiencies in essential nutrients crucial for muscle health, or compromised blood circulation. Furthermore, hormonal imbalances can significantly impact muscle health and contribute to muscle weakness. A thorough assessment is necessary to determine the underlying cause and tailor appropriate interventions. Early detection of muscle weakness is paramount in improving a patient's quality of life through timely interventions. Gentle exercise programs tailored to the individual's capabilities, combined with a nutritious diet rich in essential nutrients, can significantly improve muscle strength and support the maintenance of mobility and ADL performance. Proactive measures to mitigate fall risks, such as home modifications and assistive devices, are also crucial in ensuring patient safety and preventing further complications. A holistic approach, encompassing physical therapy, nutritional guidance, and environmental adjustments is essential for effective management and improved patient outcomes. 4. Sleep disturbances. Difficulty achieving and maintaining deep, restful sleep is a hallmark symptom of sleep disorders, often associated with cognitive decline. Individuals experiencing cognitive impairment frequently report waking multiple times throughout the night or struggling to fall asleep initially, resulting in insufficient and poor quality sleep. This disruption may stem from alterations in natural sleep cycles or interruptions in brain activity, preventing the maintenance of continuous sleep throughout the night. The resulting sleep deprivation can significantly impact daytime functioning and overall well-being. Another common sleep disturbance is experiencing shortened sleep duration and early morning awakenings. Those with cognitive impairment may find themselves unable to obtain sufficient sleep or consistently wake up very early, often before sunrise. This can be attributed to a disruption in the body's natural circadian rhythm, making it difficult to maintain a regular sleep-wake cycle. The combination of early awakenings and an inability to return to sleep contributes to reduced quality of life, leading to increased daytime fatigue and decreased energy levels. Furthermore, disruptions in rapid eye movement (REM) sleep, a crucial stage for brain restoration, memory consolidation, and learning, are frequently observed. Cognitive impairment can significantly impact REM sleep cycles, making it challenging for individuals to enter and maintain this restorative phase. A deficiency in REM sleep can lead to a decline in memory function, difficulty concentrating, and increased forgetfulness, particularly regarding recent events. Individuals may also experience vivid and disturbing nightmares or sleep terrors, further compounding the negative impact on their sleep quality and overall health. Addressing these sleep disturbances is crucial for improving the quality of life for individuals experiencing cognitive decline and requires a comprehensive approach involving medical evaluation and potentially therapeutic interventions. Sleep disturbances are a hallmark characteristic of dementia. Individuals with dementia may experience significant difficulties regulating their sleep patterns, leading to excessive daytime sleepiness or persistent insomnia. This can manifest in various ways, including daytime drowsiness, pervasive fatigue, or an inability to fall asleep or stay asleep at night. The resulting sleep deprivation contributes to daytime exhaustion and hinders the ability to perform daily tasks effectively. These sleep disturbances are not merely inconvenient. They significantly impact the overall well-being of the individual and their caregivers. Furthermore, individuals with dementia often exhibit unpredictable alterations in their sleep schedules. They may fall asleep at inappropriate times or deviate significantly from established sleep routines. For instance, they might experience overwhelming sleepiness during the day while struggling to sleep at night. This disruption not only affects their physical health, but also disrupts the routines and well-being of their family and caregivers. The inconsistent sleep patterns can also limit participation in social activities and make it challenging to maintain a normal lifestyle. The consequences of sleep disturbances in dementia extend far beyond simple fatigue. Sleep disruption significantly impacts both mental and physical health. Sleep deprivation exacerbates feelings of anxiety, depression, and stress, while simultaneously impairing concentration and cognitive clarity. Over time, chronic sleep problems can accelerate cognitive decline and contribute to behavioral issues such as irritability and personality changes. Addressing sleep disturbances is therefore crucial in managing the overall health and well-being of individuals living with dementia. A comprehensive approach involving medical evaluation and potentially therapeutic interventions is often necessary to mitigate the negative effects of sleep problems and improve the quality of life for both the person with dementia and their loved ones. Individuals with dementia and sleep disorders experience impaired alertness and safe mobility, increasing their risk of falls and accidents. Sleep deprivation hinders balance and attention, leading to increased fall risk. Furthermore, an inability to recognize fatigue and the need for rest can contribute to serious health issues, such as stroke or other severe conditions. Sleep plays a crucial role in brain restoration and repair. During sleep, the brain clears accumulated toxins, allowing brain cells to recover and function more effectively. Sleep disturbances prevent this process, leading to cognitive decline, memory impairment, difficulty with daily tasks, and an increased risk of dementia. Sleep disorders in dementia stem from various factors, including alterations in neurotransmitters, such as serotonin and melatonin, changes in brain structure, impairment of sleep-regulating brain regions, or disruptions in the body's circadian rhythm. External factors, such as an uncomfortable sleep environment or other medical conditions, like sleep apnea, can also contribute to sleep disturbances. 5. Social withdrawal and apathy. Reduced interest in social activities. One of the initial manifestations of social withdrawal and apathy in individuals experiencing cognitive decline is a diminished interest in previously enjoyed social activities. Affected individuals may lose enthusiasm for family gatherings, friendly visits, or community engagements. This reduced engagement stems from cognitive and emotional impairments, hindering their ability to connect meaningfully or participate fully in these activities. Difficulties. Maintaining social relationships. Individuals with cognitive impairment often encounter challenges in sustaining social relationships. They may experience difficulties recalling names, forgetting significant events, or engaging in coherent conversations. This can lead to feelings of shame or embarrassment, prompting a gradual withdrawal from social interactions, resulting in isolation and a sense of disconnect from their surroundings. The inability to participate fully in social situations can be profoundly isolating and contribute to feelings of loneliness and alienation. Loss of interest in personal hobbies. A significant indicator of apathy is the loss of passion for personal hobbies and daily routines. Affected individuals may no longer find enjoyment in reading, listening to music, gardening, or other previously cherished activities. Instead, they may spend considerable time alone or engaging in minimal activity. This reflects a decline in attention span and motivation, particularly when the individual no longer derives pleasure or satisfaction from previously engaging pursuits. The loss of these activities can significantly impact their overall well-being and quality of life. Understanding these changes is crucial for providing appropriate support and maintaining a sense of connection and purpose. Individuals with dementia may experience a reduced capacity for empathy, showing less concern for loved ones. They might struggle to recognize their own emotions and express them as they once did, appearing aloof or indifferent. This can lead to withdrawal from conversations and social interactions due to discomfort or a lack of understanding. Anxiety and insecurity can also contribute to social withdrawal. Dementia patients may find social situations challenging, particularly when they feel unable to communicate effectively. This often results in a retreat to a more private and secure space, potentially leading to loneliness and isolation. A further indication of disengagement is a reluctance to participate in family gatherings, social events, or group activities previously enjoyed. Invitations to parties, social events, or holidays may be declined, not due to a personality change, but rather a decline in cognitive abilities and a diminished interest in social situations. Dementia also impairs communication skills. Difficulty understanding and responding to conversations makes maintaining social connections challenging, potentially leading to withdrawal from dialogue and increased social isolation. Social disconnection and withdrawal are significant symptoms of dementia. Individuals with dementia may lose confidence in their ability to maintain social relationships, believing they are incapable of participating in conversations or social activities, leading to self-isolation. This lack of confidence and inability to connect with others can result in social withdrawal, loneliness, and despair. Cognitive decline can also impair their understanding and appropriate response to social situations. They may miss nonverbal cues, such as eye contact or gestures, leading to feelings of discomfort and awkwardness, further contributing to withdrawal. Early recognition of these signs allows family and friends to provide timely support, helping maintain social connections and improve quality of life. 6. Challenges in word finding. Aphasia. Aphasia. A comprehensive overview. Aphasia is a language disorder resulting from damage to brain regions crucial for language comprehension and production, such as Broca's and Wernicke's areas. In the context of dementia, aphasia can manifest early and progressively worsen over time. Individuals affected often experience significant challenges in retrieving words to express their thoughts, sometimes substituting incorrect or inappropriate terms, word-finding difficulties. A defining characteristic, one of the most prevalent signs of aphasia, is difficulty retrieving words. Patients may struggle to recall the names of familiar objects, people, or places. They might resort to descriptive phrases instead of precise vocabulary. For instance, instead of saying apple, they might describe it as a round, red or green fruit, often eaten in the fall. This word-finding difficulty often emerges abruptly, potentially causing embarrassment or shame, leading to social withdrawal and avoidance of communication. Para- and neologisms. Distorted language production. Another manifestation of aphasia involves the use of incorrect or nonsensical words, paraphasias, to replace words the individual cannot recall. For example, they might say, "This is that thing," instead of naming the object correctly. In more severe cases, patients may even combine unrelated words to form meaningless sentences, neologisms, making comprehension extremely challenging. This communication breakdown can be frustrating for both the individual with aphasia and their conversational partners, contributing to feelings of isolation and social exclusion. The impact on daily life can be profound, affecting personal relationships, professional endeavors, and overall quality of life. Early diagnosis and intervention, including speech therapy and other supportive measures, are crucial in mitigating the effects of aphasia and improving communication abilities. Individuals with aphasia often compensate for word-finding difficulties by using contextual clues to convey their meaning. For example, instead of recalling the word bicycle, they might describe it as something I ride to get around with 2 wheels. While this strategy facilitates communication, the resulting imprecision can lead to misunderstandings. Difficulties in sentence construction also frequently arise. Sentences may be incomplete, unclear, or lack connecting words and proper grammatical structure. Sometimes, only single words are used, hindering comprehension. Aphasia affects not only speech production, but also language comprehension. Simple sentences or familiar words may become incomprehensible, leading to difficulties following conversations and causing frustration and confusion. The severity of word-finding difficulties can fluctuate throughout the course of the disease. Initially, challenges may be minor, such as occasional lapses in vocabulary. However, as the condition progresses, language problems can worsen, impacting the ability to construct complex sentences or comprehend intricate conversations. Aphasia significantly impacts daily life, presenting numerous challenges. Difficulties with effective communication can limit participation in social activities, work, and even family life. This can lead to feelings of loneliness and frustration, as well as decreased self-confidence and a sense of loss. Conversations become difficult. Individuals may struggle to understand simple questions or respond coherently. This can result in fragmented or halting conversations, potentially leading to avoidance of social interaction to minimize pressure. The struggle to find words can cause embarrassment and a loss of confidence, particularly as individuals become aware of their altered communication abilities. The inability to communicate effectively as before may lead to anxiety in social situations. Dementia is a serious condition, but early detection allows for intervention and helps maintain a better quality of life. Did you recognize any of the signs we discussed today? If you or a loved one exhibits any of these symptoms, please seek professional medical help without delay. Early diagnosis can make a significant difference. Remember to subscribe to our channel for more important and helpful information. Your health and the well-being of your loved ones are paramount.